Hi everyone, I am going live today with Dr. Naroth Mendoza, and we are talking about men's pelvic health, which is a very interesting topic because I think that it's a topic that that doesn't get a lot of coverage. I think the conventional medical community doesn't talk about men's pelvic health a lot, and I think men don't talk about it a lot. They don't go to the doctor to get their pelvic health checked. And it is a big problem. I did a post just kind of listing all the men's pelvic health issues that face, and that includes things like constipation, pelvic pain, erectile dysfunction, things like that. And we are going to be covering all of that today, and how do we address that naturopathically and with chiropractic medicine. So hi, Dr. Mendoza, how are you doing today?
Good, how are you?
I'm doing great. And so, where do we want to kick it off with this topic? So I know that this is something that you address in your male patients. How does this normally come into your practice? Does someone come in talking about this, or is it something that you just kind of ask questions and then you figure out that, someone is dealing with this issue?
Well, usually it's a referral from a medical doctor because, the patient's having all this pain and they've done all of the blood work, ultrasounds, they've seen a gynecologist, and they can't seem to figure out what's going on with them. So I'm sort of like the last resort when it comes to men because it's not, because it's not a...
I am too.
Right? And I don't know if it's just because, like culture-wise, like men usually don't complain too much about like what they're feeling. Until it gets to the point where it's kind of like they're in a lot of pain and they're having symptoms with it, and so they get referred to MDs. MDs will refer to me, especially the ones that I'm close to or the ones that know what I can do. And so when they come in, they're just like, I don't understand why I have incontinence, because they're leaking, and they could be leaking with just doing things like, they could be sitting down, and when they get up, they feel like something's coming out, like they're peeing, but it's actually...
I've often heard patients say that it's dribbling or, it's kind of leaking out. Yeah.
Yeah. And what I found is that in men, it could be a weakness, but it's more of a global weakness. So which means that there's a weakness somewhere else in their bodies. And the pelvic floor is trying to support that weakness. And so what ends up happening is that the pelvic floor muscle becomes really tight. Because imagine if like your pelvic cavity, right, where like from your belly button down to the top of your pubic bone, imagine that as being a cavity, and it's like a balloon. So it's a closed balloon, it's tied off. And if I have weakness anywhere else, or have a lot of pressure coming from like my abs or anything like that, then it's pushing down onto that pelvic floor, and the pelvic floor now has to contract even more, so it can't actually fully relax. So it's always contracted, and it's contracted because it's trying to support the rest of the body or the organs so that they don't fall out. And so like if they had that, if you have a bladder your bladder, right? If you have all that pressure, you're pressing on the bladder. And so then what ends up happening is that even if your bladder is not as full, or if you do have a full bladder, because of all that pressure, it's causing that dribble, because it's like working so hard to try to close it off that like it just leaks a little bit.
Okay.
So, yeah. So with that type of patient, I will normally just, I find most of the answers when I'm doing the exam, just asking the history. And then usually it is a hypertonic muscle instead of like a weakness of the pelvic floor. So we work on more of like a relaxation technique. And if they don't have any leaking or dribbling or anything like that, then I check their diaphragm. And the reason why I check their diaphragm is because most men who lift really heavy or just have a really weak core has pretty tight diaphragms. And if your abdominal cavity is also a balloon, and if the diaphragm is so tight, then that means that you can't actually expand the diaphragm when you're breathing in as fully as it should be. And so it's tight at the top, and that means it pushes down on the bottom, which then pushes down on the pelvic floor.
So then are those like diaphragmatic breathing, or what kind of exercises do you have them do to work on the diaphragm?
So there's a new technique that's out that's actually been going on in Europe, or in Spain. It came from Spain. And it's been going on for a long time now. In the US, not a lot of providers like know this technique yet, but it's becoming more like people are more aware of it. But it's called hyperpressive, and it's hypo means lowered, right? And so you're trying to decrease the pressure inside your abdominal cavity, because intra-abdominal pressure is what causes a weakened or an over active pelvic floor muscle. So with that, it's just I teach them how to do a massage of their diaphragm. So they get to do this at home every day. And if they don't, then, you know, you're not going to recover quickly. And so I have patients practice the massage first. And then afterwards, I teach them a breathing. And so the breath that we're going to be doing it's opposite of belly breathing. So if a male patient comes in and they have leaking and they have a tight diaphragm, then I work on the hyper active pelvic floor muscle first, and that's through just relaxation of the pelvic floor muscle. After I do that, then I teach them how to release the tension in their diaphragm. But like the first part of it is I teach them belly breathing, because belly breathing does put a very gentle pressure on the pelvic floor, so it just helps to lengthen it. And then the other type of breaths are you're basically breathing into your ribs. So you should, I have them put their hands around the lower part of the ribs and have them breathing into their hands basically. And what you're doing there is you're just trying to stretch that diaphragm. And so you learn to do different types of breathing. And then I teach them how to do exercises with that hyperpressive breath. Hyperpressive is just the last part of basically like clearing out your whole entire system, starting from your respiratory to your abdominal to your pelvic.
Okay. And how long do you have them do this breath? Like daily, 15 minutes a day, or how long do you normally have them? Is it a daily thing that men should be doing, this type of breath to strengthen? Is it strengthening the diaphragm or like loosening the tightness? Is that?
So you're loosening the tightness, and then when you do, because hyperpressive technique will go into a type of low pressure fitness, and the low pressure fitness is what is the strengthening part of it. The hyperpressive breaths are just the relaxation of diaphragm. Once we are able to relax it, then we do the strengthening after.
Okay. And then you mentioned that actually instead of strengthening the pelvic area, you work on relaxing it. How does that area become hypertonic, or, you know, I forgot the word you used, but basically those muscles are just really tight, right? Mm-hmm. How do people get that?
It could be from anything. It could be from how we are breathing when we're lifting heavy weights. So when we are lifting something heavy, what most people do is they bear down, or they do that Valsalva move where they're holding their breath.
And that's like when you're basically having a bowel movement, when you're pushing, that's kind of that for people who don't know what that is, right?
Yeah. And so it's that added pressure. And then it's just like stress. We have a lot of our nervous system, like we have two, parasympathetic and sympathetic, right? So the parasympathetic is the rest and digest, the sympathetic is like the fight or flight. When we're stressed out, which, you know, especially in California, everyone has a pretty like stressful life, just because of work and all the other stuff. And it's really high paced. And so when we're under a lot of stress, we turn on our sympathetic nervous system. And what that does is it contracts muscle, right? Because it's ready to fight or it's ready to run away. Mm-hmm. And if we're living like that chronically and constantly, then that means those diaphragm muscles become very tight because we take shallow breaths. Mm-hmm. And so it's the breathing that's really causing us to have these dysfunctions. And that's why we, you know, anytime when someone comes with pelvic floor dysfunction or some tight diaphragm, I always start with breaths, mm-hmm. and we teach people how to breathe properly.
So when a man, or I mean anyone, but when a man is working out, since we're talking about men's health today, is working out, is there a way that they can work out where they're not going to be tensing up that area? Is there something that you usually teach men to do that?
Yeah, so if they don't have a current pelvic floor dysfunction, like they're not leaking, they're not having pain in their pelvis, they're not having all the other stuff, then they can still work out. Like, this is not like an end all where like all of a sudden you can't do anything that causes intra-abdominal pressure, right? because lifting weights does increase intra-abdominal pressure, you can't take that away. So what I have them do is that if they know they're going to be lifting really heavy, if it's like a day where it's like a strength day and they're lifting extremely heavy, then the next day what I have them do is work on their diaphragm and I work on the breathing. And that will protect their back and not lead to like chronic lower back pain, because they're going to feel some type of like tension and tightness in their backs. And this is a great way to do that, you know. And a lot of times people like will use a foam roller or lacrosse ball or do all these stretches for the rest of their bodies, but they don't do that for their pelvic floor or their diaphragm. And so that becomes increasingly tighter and tighter as they continue to do the same activity. So I will teach them that part, just the massage part, and then how to breathe.
And so what are the main complaints that men usually have when they have this issue? So you said kind of the leaking and then pelvic pain. Is there anything else like lower back pain, leg pain? Is there anything else that men should be looking at when thinking about pelvic area?
Yeah, so if someone's had like chronic prostatitis, which is their prostate, they will feel pain that's like right where, like right behind the penis and this the scrotum. If they feel pain there and it's chronic and they've had it for years, and then I would check to see if they have like that issue with their diaphragm. And then so if you're having chronic pain and you've done everything, you've done PT, you've done chiro, you've done specialists and stuff like that, and you're still having pain, then we might want to check your diaphragm. The other complaints that people have would be like pain in their penis or pain during ejaculation. I get a lot of also like kind of like an anal prolapse, like rectal prolapse. So it feels like they've gone to use the restroom, they had a bowel movement, but they still feel like something's like a ball there or there's pressure there. Then that's a prolapse, and prolapses are basically that added intra-abdominal pressure pushing down the pelvic floor, which then lets everything fall down into that cavity because we have openings there. But I do get a lot of prostatitis, and again, it's like that last resort. They come in and they're just like, I've done everything. I've seen a urologist and nothing's helping. And
they're even like, let's say, taking medication and, you know, like prostatitis medication, they're doing everything that, and that there's still like a physical thing that they need to be doing.
Yeah, it's not, I normally, they actually don't get medication because there's not really, unless there's an infection. If they've gotten a, you know, blood work or something like that, and it shows a very tiny bit of infection, they'll take medication for that. But afterwards, they're kind of just let go and so that they can't really be helped. And that's when they contact me. And just think about it, like if we have our prostate right next to our bladder, well, for men, and then you have this extra pressure that's pushing down into that area, then yeah, your prostates are going to be really irritated. And so that's what causes the inflammation, and people can't figure out like what's causing it, though like everything else is working, right? So it's
interesting. Yeah. I think it's interesting because from a naturopathic perspective, we would look at it as inflammation, and we would say, okay, so what in your diet is causing inflammation? Is there anything that we need to get rid of that's causing inflammation? We'll use anti-inflammatories like turmeric. There's some really great herbs that we use, like saw palmetto, that are really great for anything prostate related, prostatitis, BPH, etc. But it's really interesting in terms of like sometimes those things can help, but they don't help completely. And to address the physical aspects of that is a really interesting thing. The other thing that we would use are actually adaptogenic herbs, herbs for stress, like ashwagandha, which is a really great one that actually does that balancing of the kind of sympathetic response and the parasympathetic, like you were talking about, and hopefully help someone to actually feel more calm and be able to breathe deeper. So I think it's really interesting to pair these naturopathic and chiropractic modalities together. They're kind of trying to get at the same goal. But I think one without the other I think them together probably gives you the best possible scenario in terms of balancing the hormones so that your stress process comes down, and then cognitive, like consciously doing better breaths and diaphragm breaths and things like that. So I think it's really interesting.
Yeah, they're all connected. So I tell patients all the time, it's not just a physical thing, it's also mental, it's also like just hormonal, and you know, they get treated for all of those. And then the one thing that I'm missing is a physical thing. And so that's the reason why I love like pairing up with other providers, because I can only work on the physical. I even refer to like a therapist because, you know, especially now when we're in COVID, everyone's extremely stressed out. One, because they're not used to being with their wives or their partners all day long. And then again, they have to deal with kids and homeschooling for that. So that adds a lot of stress. And so I've noticed that since we've gone into COVID, a lot more men are complaining about chronic lower back pain or pelvic pain.
Hmm.
Yeah.
Interesting. And what about other types of pelvic issues like erectile dysfunction, for example? I think that's a common problem among men, and something that's not talked about a lot. But is that, how do you usually treat that from a chiropractic and also pelvic health point of view?
Yeah, so sexual dysfunction can be caused from that, just from the extra pressure that's pressing on nerves, and nerves regulate all of that, right? The arousal and all of that. And so when you have this added pressure, then that means that nothing's functioning well. And so like my last person who had, his is not like, it wasn't ED, but it was more of like pain during after ejaculation. And it was because of this extra tension and tightness. And so every time he would ejaculate, he would have this extreme tightness, right? It's already tight there. His pelvic floor is already tight. And so that created more of a squeeze. And imagine squeezing your prostate, your testicles, and everything in that area. So he was having a lot of pain. And then we really literally just worked on breathing techniques and relaxation. And within about 3 visits, it completely went away and was able to, you know, continue having sexual relationship with his partner.
Awesome. When do you know when it's you need to relax the area or you need to strengthen it? So I think when we did our podcast together, you talked about Kegels for men. So like, when is it the right time to do that versus more relaxing the area, not really strengthening it because it's too tight? How do you know the difference between those two things?
So case history, if someone says that like it's more of an emergency, like they're constantly having to just like they just drank some water and it wouldn't even be a lot, they just urinated and then they have to go again in like 20 or 30 minutes. We should only actually be urinating maybe every 2 to 4 hours, especially with drinking water and we're drinking it slowly. We're not just gulping down 32 ounces like that, because if you do that, if you drink like a whole bottle of water, then yeah, you're gonna have urgency. But if you're just sipping water today and then you're constantly having to pee, then that tells me that it's a tightness because your bladder is being squeezed, right? And so when it squeezes, then urine leaks. For someone who needs strengthening, they usually will tell me that like they feel that there's a lot of pressure there, that something's falling out. When they do certain activities like running or something like that or working out, they can feel the leaking. Then I know it's more of a, like it needs to be strengthened.
Okay. And then in that case, is a Kegel something you would prescribe, or how would you normally strengthen that area?
I would, so the Kegels that I would do with them, there's a lot of, like if they have issues with diaphragm, then I wouldn't do Kegels. I would do low pressure fitness with them. And I don't know if anyone remembers this, but like a lot of the bodybuilders, if you see how they suck in like their abdominals, that's called hyperpressive, right? You're basically taking all the pressure out from your abdominal cavity, and then you take this deep breath in, or another breath in with everything. Like, so you breathe in and out, right? And then you blow all the air out, and then you hold it at like your throat, and then you create like a closed valve, and then you do another breath in with your mouth closed and your nose closed and stuff like that, and then that creates that suctioning. So I would do that type of strengthening with them, because what is happening there is you're getting your diaphragm and your pelvic floor to work together. That's how our body works. Whatever our diaphragm does, our pelvic floor is supposed to follow. Someone who has a weak pelvic floor, when we're breathing out, the pelvic floor muscle is actually pushing down. And so I would do an assessment of that. Like if I have them coughing, I have them doing like 4 or 5 coughs. And if they cough and their pelvic floor muscle or their abdominal muscles pushes into the hand, then I would do more low fitness pressure, low pressure fitness with the men. And then with Kegels, if I don't find anything going on with their diaphragm, then I would just do Kegels with them, and I would make them kind of imagine where the muscle is, or I'd have them take a photo of like the muscle, and they can watch it. And so when they're working on their exercises, they can kind of look at the muscle to activate the brain to connect to that muscle. And what I normally tell them is that they're going to breathe out. So with their breaths out, they're going to pretend or imagine that they're picking up their scrotum. And that's how they would do a Kegel.
Okay. And what about other types of just pelvic health issues, like even constipation, for example? Is that something that you see in your patients, and something that if you do this type of work, do you see there being improvement? I mean, obviously from a naturopathic perspective, there's a lot to talk about here in terms of diet, in terms of overall kind of gastrointestinal function. But what about from a chiropractic pelvic health point of view? Is there something that you do with patients and then you see a change to like constipation?
Yes, so that could be related to the pelvic floor or the lower back. If someone has chronic lower back pain, the nerves that come out from the back and the sacrum is going into your pelvis. And so that can cause the organ itself to not function properly, especially if they do. I have people come in who says that, like, you know, they did a detox. They've really worked on their diet. They're eating really healthy and well. They make sure that they include everything. But then they're still having a lot of constipation. Then I just look at the pelvis. Like, if the pelvis is not exactly in the proper alignment, because a lot of people have like an anterior pelvic tilt or a posterior pelvic tilt. So anytime you have those types of tilt, you are putting a little bit more strain onto your nerves. And so then I would just have them learn how to like find their neutral spine, and then we work on stretching and self-manual therapy at home to make sure to relax all these muscles. And then we work on keeping the alignment of the pelvis by working on posture and core.
Yeah, that's great. And I also think sometimes the way we're having bowel movements, there's something called the squatty potty. Yeah. And sometimes actually, and so it's just like it's like a stool that you put around your toilet and you put your feet up. And sometimes when anyone has constipation, sometimes when they just do that, it's actually ergonomically the right way for us to have a bowel movement. And sometimes that alleviates constipation as well too. So I think that's kind of in line with also just the alignment of the back and everything. Because the way that we have bowel movements, if our legs are not up and we're not in a squatting position, is not the most optimal for that release.
Yeah. And basically what you're trying to do is you're trying to just, well, you know, when you're sitting, so I talk about sitting on a chair and then sitting on the toilet. So when you're sitting on a chair, for women, I would say sit on your vagina, right? And that's just because that aligns your pelvic floor up to your diaphragm. And when you're having a bowel movement, you do need to have that breathing because you have to bear down. And so if they're sitting on the toilet, I just have them like kind of like push your hips back, or like before you even sit on the toilet, pretend like there's a tail there and you have to move your tail before you sit down on the toilet. And so I have them kind of tilt their pelvis in that position, and then using a squatty potty or something to put their foot on so that their thighs are parallel to the ground. And so that allows for more mobility of the pelvis and more expansion and relaxation of that pelvic floor muscle, because you need that pelvic floor muscle to expand and relax before you can actually have bowel movement. And so that's another part of like constipation. And so if I've tried everything else and nothing's working, then I would normally refer them for an internal pelvic floor specialist who will do some like rectal manual therapy internally.
Okay. And how do you assess someone's diaphragm? Is it something that our listeners can do at home? Like, can they try to figure out whether their diaphragm is really tight, and then they can maybe start doing some breath work to try to fix that even in their own home today, let's say?
Yeah. So like to check a diaphragm, you can, I always ask everyone to lay on like a mat, a yoga mat or something like that. You're going to lay onto your back, and then with your knees bent, you're going to let your knees fall together. So when you have your knees fall together, it actually turns off your abdominal muscles and they're more relaxed. And then what you do is you're going to hook your fingers underneath your ribs. Now, and this is in a relaxed position, so try not to contract your abs or like that. And so what people will notice is that they actually can't hook underneath their ribs. And so your rib line like because your ribs come from like your sternum. So from the sternum all the way down and around is like your rib angle, right? And so you want to be able to go in there. And if you can't, then that's when you do the massages. And a lot of the times, if it's really tight, people always complain of tenderness and pain, or like an area where they're able to put their fingers in certain areas, but other areas is super tight. So that's a way to assess yourself.
Okay, cool. And then let's say someone did that, you know, today, and then they feel really tight. What are some things they can do at home? Like what's an easy breath they can do at home every day to see, and then they can kind of recheck it and see if it's improved? Is there just an easy breath that you would suggest that they can do?
So if your diaphragm are like if they are really tight and they're tender, I would work on that first, on massaging it. And so there is a way to massage your abdominal and your diaphragm, and then after you do that, when you have that mobility, then you can practice the breaths. But I would always suggest like taking a few normal breaths in and out first, then a few deep breaths in and out, and then you're going to do the massage, and then you're going to do the breaths. But if, like, let's say you don't have any tension and tightness in your diaphragm, not that much, there's a little bit, and you're actually able to hook your fingers under a little bit, then you can do some breaths where you put your hands around like your lower rib area, and then your fingertips kind of near your sternum. And then you think about like breathing in and creating that expansion. So you should feel like your hands moving out a little bit. Another way to do it, just to kind of get like that, that biofeedback from your brain to your body, you can tie it's like an exercise band, like the ones that you can get from your PT or from like Amazon, but you tie that around your ribs, and then you do the breaths, so that one, you're engaging the muscles by connecting it to the brain. And so that's another way to do it.
Mm-hmm.
And your way to do what I suggest is that, like, if you know how to do the breaths or the massages, you're always doing like three sets of three on each side, so 9. So I would have them do like 3 sets of 3. So they would do 3 first, and then relax, and then do another 3, and then relax, and do another 3 and relax. And if they practice that every day, just doing 9 breaths every day, they'll start seeing improvements. Now, if you have a really tight diaphragm, it may take you weeks before you can actually take that deep breath in with hyperpressive. And, you know, like, everyone's different. So if someone's done it and it's been like 2 weeks and they still can't figure it out, or they're still having difficulties, there's still a lot of tension, keep going, because it takes some people like 6 or 7 weeks, and it's for others, it may take them a year before they actually see an improvement in their diaphragm.
Yeah. And I also would imagine it's stress in the daily life that needs to be worked on. Mm-hmm. And that kind of helps the breath, and that really trickles onto everything else. So, you know, especially when people can't change their circumstance or their stress levels, I think that's important. So what I'm hearing is stress plays a really big role, and that does have an impact on breathing and how much we're tensing our bodies. And also when people are lifting and working out and lifting heavy things, they're really bearing down and tensing that area. And if they're doing that a lot, and we're also doing that when we're stressed out as well too, right? Yep. We're kind of like tensing that area. And so what you're seeing is this can play a really big role in a lot of pelvic health issues. I'm sure for women too, but for men. Yep. And that would include pelvic pain, that includes erectile dysfunction, it includes even constipation. I mean, like all of the above of anything that's going on there. And I think that would make sense because you're tensing that area. Now everything in that area is just going to tense up and not work the way it's supposed to work. Yeah. Is that what I'm hearing? Right. Yep. Okay. Cool. So from a naturopathic perspective, I feel like we're trying to kind of do the same thing, but I would say that there are cases I've had where we're giving supplements, we're changing diet, we're taking inflammation down, and I still feel like maybe, you know, the patient is 75% better, but then 25% is still going on. And I think sending that patient to someone like you, where there's now a physical aspect that we need to deal with, I think is really important. I think sometimes I also get patients to relax, and I don't think I've even connected the idea that the breathing, the relaxing, it's actually affecting the pelvic floor. So I think that connection you made today is really awesome. And I think I'm going to take that with me in my practice too, with my patients. And I'm sure people listening, hopefully will take that too. And I think we should all, today I'm probably going to pay attention too to like when I get stressed, how much I tighten up, and
Yeah.
I mean tightening up everything, including my pelvic floor.
Exactly.
Yeah,
If
I
you
think
feel
everybody
like,
should pay attention to that, actually.
yeah, I tell her, like, I will tell sometimes, like, if they have a tight pelvic floor, I want them to put a timer on their phone and see how many times they catch their glutes like clenching. So as they're sitting and working, they don't know that their glutes are clenching, but that's clenching and tightening the pelvic floor. So just by changing that habit makes a difference.
Yeah. So pay attention to your glutes while you're just sitting there working. I would check in with that, because I often tell patients, okay, check in with your breath at least once an hour. So I actually have patients put an alarm on their phone and check in with their breath once an hour. But it would be interesting to tell them, okay, check in with your breath and check in with your pelvic floor.
Yeah.
Your glutes, are you tightening? Because more than likely, if you're not breathing, you're also tightening your pelvic floor, it sounds like.
Yep.
Awesome. So is there anything else you would like to add or talk about in terms of pelvic health for men?
I think there's a few questions that were asked, right? And so someone had asked, like, to cover the root cause of the burning sensation. So I'm not really sure what they were talking about with burning. I'm thinking it has something to do with the prostatitis, that burning sensation that they feel behind, like, their pubic area. So that is a sign, like, if they've done everything else and they can't figure out that there's an infection or like that, but they still feel that burning sensation, that's usually a nerve. Or an irritation. It's inflamed because of the irritation constantly, right? Because if you constantly take your hand and rub it up against an area, and you do that all day long for days, then yeah, you're going to create an irritation, and your body's going to react to that. And so if that's what that person is talking about, they should definitely get their pelvic floor checked or their diaphragm checked assessed, and to see if it's the added pressure in their abdominal areas that's causing them to have burning sensation. The other thing that was asked was, can all of these pelvic health conditions in men, can they be reversed? And the answer is yes, they actually can be. If you're experiencing some tightness and you're noticing that you're having urgency, you're having constipation and a little bit of pain, I would go and get checked right away, because the earlier the intervention, the better the outcome and the faster the outcome. And the longer you wait, it can become chronic. Like, I've known women that have, like, leaking issues, or even men, for, like, years, and they never got any treatments for it. And so when I see them, it actually takes a lot longer, because for 10 years their body has adapted, and they adapted the wrong way, because that's how we have to survive, right? Like, any changes in our body, any damage, any repetitive stress, our body adapts to that. So you may feel pain for a month or two and then it goes away. It doesn't actually mean that it goes away. It just means that your body's adapted to the change.
Yeah. And so when you say they should get checked, who are you talking about? A urologist? Are you talking about a chiropractor like yourself who does pelvic health stuff? What are you talking about when you say that?
I would say checking with a chiropractor who does pelvic health. And we're very limited. Like, there's not a lot of chiropractors who do pelvic health. There's a few. I think there's one in, like, Sunnyvale, and then there's myself in San Mateo. And I think it's because, like, I think globally, and I also look at the alignment, and I look at the joints, and I look at the muscles and stuff like that. And you probably will get the same thing with a physical therapist. But, like, I add that component of an adjustment, because adjustment helps the nerves. And so,
and you're in the Bay Area, in California, here in the Bay Area, many people on this call won't be there. Where can somebody find a practitioner like yourself who does pelvic work? Where can they find someone like you, maybe in their local area? Where can they find that?
I would definitely go to a website called Herman and Wallace. And in there, there's a place where you can locate a provider. Even if you type in pelvic health therapy, you're going to see a bunch of things pop up in your area. And it will say, like, they work with pelvic health or pelvic floor dysfunction. And there's a lot of physical therapists and occupational therapists that are extremely good at what they do. And so you'll have a good list of all those people, because the biggest institution that teaches pelvic floor therapy and stuff like that is Herman and Wallace. So I would definitely check in with that. And then the other person that you can also look into is a urogynecologist. They have, if you go to a urologist, they know things about the urinary system, but they may not be as experienced with the pelvic floor and all the other stuff, right? But if you go to a urogynecologist, they look at that whole area. So that's another option, because a lot of times in order to go to see a physical therapist in other states, they have to get a referral. So I would start with your general practitioner, ask them to be referred to a urogynecologist. Once that happens, and they can say like, hey, you may need some manual therapy. And so they'll refer you to usually a physical therapist or an occupational therapist.
Okay, great.
Yeah.
And then from a naturopathic perspective, I think that there's often inflammation. There's often hormonal dysfunction, that's causing these problems also. There's often an emotional component. And so I think also once you kind of get those diagnoses, I definitely think the physical part should be addressed with someone like yourself. And then from a root cause point of view, which your urogynecologist I forgot what it was called, but won't necessarily address. I think seeing a naturopathic doctor locally is really important. And you can go to aanp.org, I believe. That's our Association of Naturopathic Physicians. And then kind of get to the root cause of the more systemic, inflammatory, hormonally based stuff that's going on. Oftentimes I tell people when you're dealing with an issue, it's not just one thing. It's often 10 things that are causing this problem. So there's the physical, there's probably the emotional piece, there's the food piece, there's, the toxin piece, and we kind of have to address all these things. So as a naturopathic doctor, I'll take on a case and I'll say, okay, I think you need to see this person and this person for the emotional piece, for the physical piece, etc. But I think that all of those things together, I think then you're gonna find a solution. And so I think in terms of that person's question, I think if you do tackle it in that way, I definitely think these things can be reversed. It also depends on how long you've been dealing with it. As you said, Dr. Mendoza, it's like you've been dealing it for years and years and years and you've never done anything about it. It's going to take a long time to fix that problem because you're going to have to now reteach these muscles and et cetera, and from a naturopathic perspective, your gut mucosa can be damaged and other things can be damaged, and we really have to rebuild all that. So if you are a male or a male who's having these issues, let's get it checked ASAP so that we can get to the root cause and get to the bottom of it. So great.
Yeah.
So
I wanted to say, I did forget to include that. Yes, it's very important to see a naturopath because of that inflammation. Just like a previous patient that referred to you, I've been working with her. She has endometriosis, and she, with all the stretching and relaxation, she's felt better. But she has this constant bloating. So every time she has bloating, it increases the pain that she feels. And that's when I had contacted you. And I was like, hey, what can we do for this? And then I suggested, I was like, hey, maybe you should go see Dr. Fong, because she's a naturopath and she's an expert in this, and she can figure out the bloating part. That's going to take away that extra pressure, and then we can really improve.
Yeah, I think that's a really good point. So looking at gastrointestinal function, and actually as you were talking about the breathing, I was thinking, oh, I bet bloating plays a really big role too. Because when you're bloated, it's people feel like they're 9 months pregnant. And that, of course, I'm thinking will increase the intra-abdominal pressure and then affect all of the same things you were talking about too. So I think all of these things are really important. And I think just starting somewhere, even if it's just seeing your urologist and then getting a diagnosis, and then now taking that to a naturopathic doctor plus a chiropractic doctor who does pelvic floor, I think you're getting a very well-rounded approach to dealing with your pelvic health issues. And there's a lot of herbs, as I mentioned earlier, that we use, but it's really based just kind of like you said, we really have to analyze the situation and decide which herbs are really the best to use in this situation. So ashwagandha, maca, saw palmetto, hawthorn, nettles, all these are really great herbs that we use from a naturopathic perspective. But I don't think it's you can just kind of grab them off the shelf and feel like you're going to get everything you need, because the assessment's really important. And then again, there's so many elements usually to fixing these problems that it's not just one thing. So, so on that note, if you are in the Bay Area, Dr. Mendoza, can you tell us where we can reach you, where are you located, and how can people find you?
Okay. You can go to my website. It's BeFreeLiveWell.com. And if you need to contact me, you can email me at Dr. Naroth at BeFreeLiveWell.com. And I'm in San Mateo, off of like the 92. But if you just email me, I try to email everyone back within a day. And then you can also go onto my IG because I'm always posting something on there.
Great. So I will put your information in the post where we post this. And thank you so much. This has been really fun. We did a whole 3 series on pelvic health. I've really learned a lot. I've gotten a lot of education. I hope everyone else has too. And I think definitely I'm going to be checking in with my glutes and seeing how much I'm tensing up. And I guarantee you I'm doing it a lot. So I'm going to try to tune in with that. I hope everyone else tunes in with that. And we start to work on that. And because I think it seems like a very important thing that as we get older, this starts to become a bigger problem. So I think it's important to take care of it now. So thank you so much for joining us. Thank you everyone for tuning in, and maybe we'll do it again and talk about some other stuff, right? Dr. Mendoza?
Yeah.
All right, everyone, have a great week. All right, bye.